Medical experts say one of the best ways to prevent the flu is with vaccination. I spoke to Dr. Ken Redcross, internal medicine specialist and concierge doctor. He discusses the importance of staying virus vigilant to prevent the flu and other sicknesses.
You know, we all talk about the flu season, and it's true, there is the flu season that we need to think about, but there's some other viruses that we need to talk about as well, just to make sure that there's some awareness and some education around it. So when you're talking about influenza, everyone realizes that the flu is bad, but it affects our economy to the tune of about $87 billion each and every year. That's about 30 million patient visits to my office and doctors' offices all across the United States. So it's important. The flu actually peaks in February and can go all the way out into May. So I wanted to make sure everyone realizes the importance of staying virus vigilant. Now, it's important also to come and see us, your doctor, within the first 48 hours if you can, because if you do, there are some medications that we can write with our prescription pad. But I'll be honest, it's tough for patients to kind of know they're dealing with the flu or dealing with the cold. So if you miss that window, there are some homeopathic ingredients called oscillococcinum. See, oscillococcinum has been shown in studies to decrease both the severity and the duration of flu-like symptoms when taken within the first 24 to 48 hours. And oscillococcinum also is good for kids 2 years of age and older. So I love talking about some of those remedies that are closer to the earth instead of thinking about a prescription pad. Now, there's also been some studies that show that vitamin D deficiency may make you more susceptible to also getting the flu. So make sure that your vitamin D levels are checked. And we're talking about the flu now, but there's another virus we should probably talk about that a lot of us don't think we know about, but we do, because this is the one that shuts down daycare centers or shuts down cruise ships, and that's the norovirus. There you go. So you know about it. And so the norovirus, highly infectious, and that's why I have this bar of soap here, because it's important for us to make sure that we're washing our hands regularly with all these viruses, but especially with the norovirus. I also wanted to make sure that we talk about the importance of hydration, because with the norovirus, you get a lot of vomiting and a lot of diarrhea. Thank God it usually only lasts about 48 to 72 hours, but you have to hydrate. And I have coconut water for my folks who say, "Doc, I hate drinking water." Well, coconut water is good for you, has a lot of electrolytes, and it's also flavored now too. And then the other virus you and I talked about, the Coxsackie virus, is a virus, you typically see this in kids 10 years of age or younger. This is the one that causes the hand, foot, and mouth disease. You get a blistering rash on the hands, the foot, and the mouth. The hallmark of disease here tends to be that of fever. Fever can unite all three of these. So when you're thinking about Coxsackie virus, there's no direct treatment. It gets better on its own, but you want to make sure, consider things to make sure you lower your temperature externally. Cool washcloths to your forehead, to the back of your neck, that sort of thing.
I wanted you to tell us about the fact that a lot of times when people have fever and they feel like they have the flu, they turn to antibiotics. Yeah. Experts like you say antibiotics is not necessarily the solution.
No, it isn't. And you know what happens? We all get on and we all talk with Dr. Google. And Dr. Google tells us that we need the antibiotic, right? Yes. Well, we don't in this case, because all these three viruses that we talked about, they're not amenable to antibiotics. In other words, antibiotics are only for bacteria, not for viruses. So it will do absolutely nothing here. So don't beat your doctor up if your doctor says this is viral, antibiotic won't help. Now, with viruses, it's a lot about supportive care, making sure you're keeping your stress low, making sure that you're not making your immune system more susceptible to illness. Yeah. So it's really it's a holistic approach in a sense.
Because bacterial is when you really go to the next level in terms of treatment and looking at antibiotics.
Well, you do, but you know what's fascinating is that in a way that I can explain is viruses are kind of already like dead material, if you will. Bacteria are constantly regenerating, and antibiotics take advantage of that. They take advantage that that bacteria wants to build a wall to protect itself. So antibiotics go and poke a hole in that wall so that the bacteria can't do that. Vaccinations can be beneficial for some viruses, but they're a little bit different in the way that you're actually able to kill them.
What are some of the takeaways here?
So I think the important thing is really about being vigilant. So hand washing, making sure you're getting rest, and last but not least, you got to manage your stress, because your stress, when it's heightened, guess what? Your immune system goes south. So you want to make sure that you really have your whole, kind of mental self together too.
And that's our health report for today. To stay in touch, find me on Twitter @Linord Moudou.